Well, the health officials in the Democratic Republic of Congo are racing to contain a new Ebola outbreak. At least 2 people are confirmed to have died of Ebola in a remote village in the northwest of the DRC, and over 30 others are suspected of contracting the virus. The World Health Organization has released over 10 million rand from its emergency fund to respond to the outbreak. The WHO and medical aid group Doctors Without Borders are leading the response and have sent experts to the site. Now, for more, we are joined in studio by Dr Rufaro Chatora, WHO representative in South Africa. A very good morning to you, sir. Thank you very much for joining us this morning. Essentially, based on your interaction with the medical situation on the ground, can you give us an update from that?
Yes, thank you. The situation is evolving. About a week ago, when the outbreak was declared, we said that there were 21 cases with 17 deaths. As of Sunday, the numbers have increased. We now have a total of 42 cases with 23 deaths. And since the declaration, medical teams have been declared to the area, which is Bikoro, Ikobo in northwestern DRC.
Now, what plans are in place to prevent new infections from occurring?
Well, with Ebola, there are a number of interventions that are put in place. Of course, we have to care for the sick by putting up the treatment centers and deploying health workers. And to enable them to work, you need to deploy medical supplies. With Ebola, you have to have protective clothing. This has also to be deployed. But beyond that, we have to follow up for each case the contacts and the contacts of the contacts so that we can contain the outbreak. And beyond that, we also have to manage the burials so that we ensure that they are safe, because some of the practices that are carried out during burials are the ones that promote transmission, like washing of dead bodies or sharing of clothing.
Yeah.
And then beyond that, we have to share information. We call it risk communication, about how the people can protect themselves. So all this is part of work that is happening within the affected area.
Yeah.
But beyond that, we also have to think about the whole country and the region as a whole to ensure that people don't move around and then cause further transmission.
Yeah, that would then be my next question. Can this latest outbreak be considered a public health event, or rather something of international concern?
We are currently looking at that. For an outbreak to be considered a public health emergency of international concern, it has to meet certain criteria. One, there has to be risk of international spread. 2, there has to be interference with travel and trade. And then, so that has to be assessed based on what is happening on the ground, and also the need or not for a coordinated response beyond what the country itself can do. So that's being assessed. If it's felt that it should be escalated to that level, then the Director General of WHO will call what we call the emergency committee to then look at all these issues and make appropriate recommendations towards that declaration.
The first Ebola outbreak that we had, the WHO was widely criticized for what was described as a slow response to the outbreak. Going forward, what mechanisms and contingencies have been put in place to ensure that the response is very, very reactive and rapid?
There has been many changes in WHO since the outbreak in West Africa. One of the things that happened with this outbreak was once the information was shared with WHO, within 24 hours, a team was deployed to DRC, and then within 24 hours, they were in the affected area with funds to support the response. And then laboratory support was available to enable testing of samples and be able to follow up all contacts. All this has changed. And then working with international partners, within a few days, the international partners were also in place. And so these are major changes compared with what happened in West Africa. And in fact, the last outbreak that took place in DRC last year was contained within a month. Mm-hmm. So that demonstrates that there's been major changes.
Let's talk about this new vaccine that has come forward. We do believe that the first batch of 4,000 is set to be released. Just take us, where it's going to be tried upon and how essentially does this vaccine work?
Yes, it's true. 4,300 doses of the vaccine has been deployed to DRC. Maybe it's on its way now to the affected area.
Yeah.
It will be used to do what we call ring vaccination. So if there is a case, then we vaccinate all the contacts of that case plus the contacts of that case, mm-hmm. To prevent further transmission. We also will prioritize vaccinating all health workers, local and international, who might be working with Ebola in the affected area. This, we think, is a major step forward in containing the outbreak. Mm-hmm. How does the vaccine work? This vaccine, fortunately, it doesn't contain Ebola virus. However, when it's given to a person, it mimics Ebola and then helps the body produce antibodies against Ebola. So that blocks the transmission of Ebola. And it was tried in Guinea in 2015. Okay. And it was found to be 100% effective. But it's still a vaccine under development. So we hope it will show that level of efficacy in DRC as well.
Yeah. Now, you in explaining, the situation and the processes, you keep mentioning in terms of the cases, the contact with the contact, in finding information in someone that has Ebola, who they've come into contact mm-hmm. with. Just take us through some of the challenges that the medical personnel go through in treating the cases.
Yes. The first thing that we need to share is that Ebola is a forest disease, because remember, it jumps from animals in the forest to human beings. So most of the areas where Ebola outbreaks occur are in forests, which means they are inaccessible. This is the case in DRC today. Accessing the affected area is very difficult. So that's the first difficulty we are facing. So we have to airlift both personnel and supplies from Kinshasa, the capital, to Mbandaka, and then by helicopter to the specific area. So that's the first issue. Then there are facilities required for the medical people who are deployed to help with the response. That has to be provided. Then there are issues to do with the cultural beliefs of the people, which you need to understand first before you can deploy an intervention. Because if you just deploy interventions without understanding the cultural beliefs, then the people will not believe you, then you won't be able to be effective. The other major issue is that this area is close to the Congo River. The Congo River is used to transport people and products up and down the river into DRC itself, to Kinshasa, to Congo Brazzaville, to Central African Republic. So that's a risk for further spread of the disease. So we have to put in place mechanisms to contain it in the area. So these are some of the challenges.
Definitely. We thank you very much for your time this morning. Of course, Dr. Let me just make sure that I give you your right designation, Dr. Rufaro Chatora from the WHO representative in South Africa, giving us more information with regards to the vaccine that will be rolled out in the DRC with the new cases of Ebola. Also confirming for us in studio that the cases have now risen, confirmed at 42 with 23 deaths and not 17. We thank you very much for your time this morning.